And Memorial Hospital in Martinsville is seeing a nearly 50% increase in opioid and heroin-related use compared to this time last year. 50%. As we reported yesterday, the Martinsville-Henry County area is now the tops in the state for opioid and heroin-related overdoses. WSOS 10's Colter Anstead explains how the hospital is responding.
Doctors in the ER at Memorial Hospital say since last summer they have noticed an increase in patients using opioids or heroin.
Already this year, starting in the month of February, we've seen about a 40% increase, and that's year over year to date.
While that number may seem shocking, she says it's not.
We've seen opioid uses. In the early 90s, there was lots of drug trafficking and stuff in this community.
One of the reasons for the increase now may be that it's getting harder for users to get pain medication from their doctors. Dr. Richard Perrin says that is leading to an increase in people self-medicating.
The trend in medicine is to back off in terms of chronic pain. And so a lot of patients who have had chronic pain or had issues with chronic pain are having difficulty finding their narcotics, and as a result, they're using medications that come from the street.
Backing off the amount of medication prescribed is what the hospital started doing last summer when it began noticing an increase in opioid and heroin use, and Dr. Perrin believes it's for the better, even though the patient may not be happy.
We're taking care of the individual and not taking care of the satisfied patient.
Because of the increasing amount of opioid and heroin use, he now prescribes the potentially life-saving drug Narcan to the families of overdose patients, and he recommends anyone who has a family member struggling with opioid or heroin addiction have Narcan readily available. In Martinsville, Colter Anstead, WSLS 10.
A dangerous drug that's not only deadly to the user, but others standing close by is being found in high volumes in Franklin County. As you may remember, the Virginia Department of Health is reporting a rising number of fentanyl overdoses. In fact, the number of cases has increased by more than 400% in the last 4 years. As WSLS 10's Rachel Lucas found out, deputies are having to protect themselves from accidental overdoses while investigating these cases.
Every deputy with the Franklin County Sheriff's Department keeps 2 doses of naloxone in their vehicles at all time. It's enough to save one person who is ODing from any type of opioid medication. And just to show you how dangerous fentanyl is, they tell me that it takes 6 doses to save someone on fentanyl. It's a deadly drug that's now not only dangerous for the user, but potentially innocent bystanders near the substance.
Everybody should be concerned about it.
Major Michael Bowman with the Franklin County Sheriff's Department says it doesn't take much to accidentally overdose, even if you're not using the drug.
You can accidentally have an overdose by coming in contact with it.
Effects that can happen in only minutes.
How serious of effects could happen to me if I'm around this or if I touch it?
You would die. That's how serious it is.
As the illegal use of the drug becomes more popular, that explains why more and more overdose deaths are related to its use. Now that a case has been confirmed in Franklin County, Major Bowman says not only must they protect the public, but also their deputies from hazards when responding to cases. This year alone, they've saved the lives of 10 people who were overdosing using that naloxone they carry. At $75 each, plus more protective gear to protect deputies, it's going to be a costly but necessary measure.
So we're going to begin to take measures in our department to be able to equip our officers with the protective gear that they need to be able to protect them when they know that they're in that type of environment, that they don't breathe it. They have the protective gloves to put on so they don't touch it. But we can't protect for everything.
And for more on the trend of the rise of fentanyl around the Commonwealth, we've posted a link on our website, WSLS.com.
Our top story tonight, a mother's emotional warning after her daughter is found dead in a dumpster on the other side of the country. Las Vegas detectives are working to find Tess Henry's killer. The 28-year-old spent much of her life in Roanoke, but an addiction to opioids led her to Las Vegas. There, she spent weeks in a rehab clinic, but on Mother's Day of this year, she called her mom and said she had walked out and was back on the street. Just before her body was found, the family was making arrangements to bring her back to Roanoke. Now her mother is speaking out, warning about the dangers of opioid addiction. 10 News reporter Arisha Jones has the story.
Patricia Merriman comforts herself by remembering her daughter at all stages from her young life. And this picture of Tess Henry is one of her favorites.
This is one of the pictures that I want to use as at her service in remembrance.
Her mother says she was a shining light in the family, but Henry struggled with the opioid addiction for almost 5 years, starting with prescription cough medicine. Merriman says she wanted to get better.
And I kept saying, Tess, we just want you home. We want you home. We love you. We want you home. And she would say, I'm coming. Don't worry about me, Mom. I'm coming. Don't worry.
Henry went to Las Vegas earlier this year for treatment, but left before she completed the rehab program. On Christmas Eve, her body was found burned in an apartment complex dumpster. Merriman is an advocate for the dangers of addiction and the need for funding for better treatments.
This is a disease, and it is a long-term, and it is a chronic disease. And one of the biggest problems, I think, is that it has been always viewed as something that we can treat short-term, and we can't. We have to look at, and it's very difficult. I don't think there's any magic solution yet that I know of.
And until a solution is found, Merriman says she will remember her daughter as a woman full of life. She leaves behind a young son who she loved dearly.
Not only was she just so magnificently beautiful in her face and her smile, but she just had a way that she made everybody around her feel so blessed and so happy.
In Roanoke, Arisha Jones, 10 News, working for you.
Tess Henry was a graduate of Cave Spring High School and attended Virginia Tech and UNC Asheville. Last year, Virginia declared opioid and heroin addiction as a public health crisis. Now Roanoke County is reaching out to the community to raise awareness of an epidemic that is taking so many. 10 News reporter Allison Wickline brings us the story.
My son was a drug addict.
The drug epidemic took center stage at Thursday's community meeting at Glenver High School. With the help of the Roanoke Opioid Heroin Task Force and the Prevention Council, Roanoke County Public Schools is hosting a series of meetings to discuss the reality of opioid and heroin addiction and how it hits home right here in the Roanoke Valley.
The disease of addiction is something that is a brain disease. It's not a moral failing, and we need families to take it from under the table and put it on top of the table and really talk about what that disease looks like.
The faces of heroin, but honestly, the people that we deal with look like that.
During the meeting, a law enforcement officer presented staggering new statistics as dozens of parents and students listened intently. The average age of a heroin user is 21 years old and getting younger. Since the beginning of 2017, the Roanoke Valley has seen more than 300 overdoses.
There are students, very young students, middle school students, high school students that are becoming addicted.
According to law enforcement, the 3 most abused drugs by high school students besides alcohol and marijuana are Vicodin, Adderall, and Oxycontin. That's why prevention efforts are focused so heavily on prescription drugs.
Now that we know that the connection is from opioids, pills, pain medication directly to heroin, we need to get in front of this.
Organizers are hoping the meetings make it easier to discuss the warning signs and risks of addiction. They hope to prevent drugs from taking people that are simply too young. In Roanoke County, Allison Wickline, 10 News, working for you.
Roanoke County will be hosting another meeting on January 18th. That one will be at Northside High School. Then there will be another one January 22nd at Cave Spring High School.
10 News reporter Rachel Lucas watched the announcement with Carillion doctors today and has more on how this could impact our region.
A presidential address that resonates across the nation and even here at home.
What scares me is how this has escalated so much.
Janine Underwood, executive director of the Bradley Free Clinic, would know. Losing her own son to the disease, she now works to help others through the HOPE initiative. Launched a year ago, they've already treated 140 patients battling drug addictions here from our area.
People are dying. If you look at those numbers, if you total up in the last few years how many Americans have died, over 200,000, that would wipe out the entire Roanoke Valley.
Despite the life-saving work they do,
it scares me how we're going to get out of this. You know, funding is absolutely needed.
funding is hard to come by. She hopes Trump's announcement will bring that money to our community.
Everything from prevention to recovery, we have to cover all of it. I think it's going to take decades to get out of this.
The federal government is aggressively fighting the opioid epidemic.
We watched the announcement with expert and Carilion Clinic doctor John Burton.
He really took a lot of the effort, as I believe the First Lady did as well, to really take away the stigma of addiction.
He also noted President Trump mandating certain training requirements for all prescribers, which Burton believes will be easily accomplished on the state level. But like Underwood, Burton says funding from the president will be the key to making a difference.
So any step forward, we'd like to see really aggressive steps to funding.
In Roanoke, Rachel Lucas, 10 News, working for you.
So many people across the country are dying from opioid overdoses that organ donations are actually at a record high.
Drug overdoses are now one of the leading causes of death in organ donors, especially among young people.
WSLS 10's Rachel Lucas went to the United Network for Organ Sharing headquarters in Richmond and found in the past decade alone, organ donors who have died from drug overdoses have increased by 500%.
Here in Richmond at the headquarters of UNOS, death is simply a part of living. Through the work done here, from tragedy also comes the gift of life.
This is a blessing for them, but clearly it comes as a result of a tragedy for somebody else.
The tragic killer that's now claiming more lives than ever before is overdosing, especially on opioids.
I think it's something that surprises a lot of people. Because clearly people think of organ donation and typically they think of traumatic accidents, but now drug overdose is a big part of the organ donation process.
According to data collected from UNOS, here in Virginia, overdosing is ranked as the third most prominent cause of death among organ donors. This year alone, they make up 12.8% of causes of death among donors. That number has increased dramatically over the past decade.
In terms of causes of death for organ donation, it's now larger than automobile accidents.
A statistic that Dr. Klassen, the chief medical officer at UNOS, says is unprecedented growth.
It's a 500% increase compared to 10 years ago.
500%, that's huge.
It's huge.
A trend they really started to notice 4 years ago. Klassen said it started in New England, spread through Appalachia, then to the upper Midwest, now claiming the lives of those all across the country. Just outside UNOS is a National Donor Memorial lined with yellow roses, the official flower of a donor. Putting a face to that statistic, here we are reminded that those numbers are people, family, friends. These names engraved on the wall represent the thousands who, in death, allow someone else to live. It puts a changed perspective on donation.
And here in the memorial, this is what's known as the grove. For every drop that comes from this fountain, that's meant to represent the life-saving gift of organ donation. And we now know that more young people are giving their organs, not because of a traumatic incident, but because they essentially are taking their own lives due to accidental overdoses. I think anytime there's almost a bittersweet that goes with organ donation.
Well, that's actually true under all circumstances, but I think it's especially, notable under the situation of an overdose death of a young person.
Because of the opioid crisis, it's the first time in recorded history that there's a surplus of young organ donors. Despite overdosing, Klassen says their organs are still quite viable.
A lot of people don't understand that people dying of overdoses can become donors. And in fact, they are very good and appropriate donors in many respects. They tend to be younger, and they tend actually not to have a lot of other illnesses associated with them, such as diabetes or heart disease, because they are a younger group of people as a general rule.
I think that's interesting. There's a stigma that follows addiction in life and in death.
Yeah, unfortunately, that's true. Donation under these circumstances has a bit of a stigma attached to it because of the possibility of disease transmission, although very, very low. And I think dying from an overdose there is some stigma attached to that. So I think one of our goals is to try to get awareness out that, in fact, these donors are really appropriate and can be used very, very successfully and can prolong somebody's life or save somebody's life.
Safety remains a priority. All organs are inspected by doctors before being given to another person. Clausen says the risk of viral transmission is less than 0.1%. Through a tragic epidemic sweeping the country, killing tens of thousands each year, others are ironically being saved. For many families, that gift of life comes as the only comfort after losing someone to addiction.
It is clearly a sad, it's a very tragic situation for a lot of families, for the entire country. But I think if, we look at it as, kind of getting a little bit of good out of what is clearly a bad situation.
While there's no question the good a selfless act like becoming an organ donor can bring to others, many are facing that reality at a much younger age than needed to, meaning that the rise in available organs to those in need is sadly only a silver lining in a much larger and growing epidemic.
Now, as we wrap up our series tonight on the faces of addiction, tonight we introduce you to perhaps the most unlikely sufferer that we talked to.
Virginia State Police recently documented the story of the Allegheny County Sheriff and his son who got addicted to heroin. State Police are expected to release the training video statewide this fall. Tonight, we're telling their story and what's to come in the next chapter.
You're going to see things. You're going to be tempted. You're going to have to make decisions.
At every 5th grade DARE graduation, Allegheny County Sheriff Kevin Hall addresses the graduates. As the department leader, he encourages students making sound decisions starts early. But that isn't what got him choked up at this ceremony. Introducing the graduation speaker, his son Ryan brought him to tears.
You never see yourself and your family ever going through this situation. You just don't think it'll ever happen to you.
It being Ryan's heroin addiction. The past 3 years have been tough for the entire Hall family. An unexpected path from the oldest son with a promising future.
In my mind, one day he was going to be a lawyer, and he was going to be probably a politician. He might even be the governor of the state of Virginia.
At Ryan's own DARE graduation, he was selected as an essay winner. In high school, he went on to serve as the Virginia Youth Attorney General, occupying his own office in the state Capitol building. Even a full academic scholarship to college couldn't prevent him from falling into the pit of addiction. It all started with a football injury Ryan's senior year at Covington High School that led to multiple surgeries.
Probably for a year straight, a year or maybe even over a year, I was on and off painkillers every day, so prescribed.
A prescription, the launching point for many heroin addicts. But when Ryan's doctors stopped writing prescriptions, a dope dealer started filling the void.
A guy said to me, if you like prescription so much, you should try heroin. And I had never even heard of heroin before in my entire life.
Ryan says his heroin use started out once a week, but then progressed to every day.
When you're getting high, you're already wondering and planning how you're going to get high again tomorrow. And I wasn't even getting high, I was using the drugs to not be sick, So the fun of using drugs was just not there anymore. I was just doing it to keep well, to be able to go to work.
He describes the withdrawals like having the worst case of the flu you've ever experienced. He eventually served 18 months behind bars for check fraud, investigated and arrested by his father's own deputies.
There was a time in my life during that time that every time my phone rang late at night, I was just waiting for that phone call that, hey, my son had overdosed and died from this addiction, or that he had gotten shot or killed, or he was involved in something really bad. And it's just, when he went to jail, it was like, unfortunately, I hate to say this, but it was kind of like a relief that you knew he was safe.
In that time behind bars, Ryan was able to get clean and stay that way.
Whenever the drug task force is looking for somebody who has heroin, one of the last people they're going to look for is the sheriff's son. So I used that to my advantage, and that didn't help me at all. That just got me deeper and deeper into an addiction.
Ryan was using 10 bags of fentanyl a day, all at one time. His father says it's enough to kill most people.
And how he was able to survive, I think it's just a message from God that there's a purpose for you out here to share your story to help save someone else.
It's been a long, tough road.
That's exactly what he's doing now. owning his story. The students gain wisdom from his painful past, and in return, Ryan gets to look forward to another day clean and sober.
It holds me accountable. It makes me have a little bit of responsibility. You know, I wouldn't feel right if I went out and got high this week and I got to come do this interview with you next week, because I feel like I'm living a lie.
After years of struggle, he's now speaking and living the truth.